Thank you, Mr. Chairman. This bill is deeply troubling to me. Let's be forthright about what this bill could do in our states, in Wisconsin, and across the nation. It could kick our most vulnerable citizens, including patients with cancer, women who are pregnant, people with disabilities, seniors in nursing homes, off their health insurance and leave them without access to affordable health care or coverage. States could scale back or even entirely eliminate the children's health insurance program, leaving kids with everything from ear infections to cancer without health care coverage. And states could refuse to provide coverage for parents and non-disabled childless adults over 34% of the federal poverty level with health care. Mr. Chairman, we often throw around numbers without thinking about what they really meant. So let's explore this in a little more depth. 34% of the federal poverty line. This means that if a Wisconsinite makes more than $3,702 a year, $3,702 a year, the state could refuse to provide health care coverage. That is morally reprehensible. We know that there could be immediate consequences in many states, including Wisconsin. Should this bill become law, it would allow our Governor Scott Walker to make the very steps that he outlined in his budget adjustment bill earlier this year that significantly alter, I'd say even gut our Medicaid program by eliminating insurance coverage to up to 63,000 Wisconsin parents and 6,800 childless adults. Moreover, this bill could open the window to allow the governor to make even more drastic changes to one of our Medicaid programs, Badger Care. Now, even though it pains me to do so, let's just set aside the moral reasons to protect our vulnerable neighbors for one moment. Proponents of this bill have asserted that repealing the maintenance of effort provisions is necessary given immediate state budget problems. What these same proponents fail to recognize is that this is not a plan that will save states money. Rather, it would simply shift costs and result in very expensive consequences. When individuals are uninsured, they are much less likely to seek preventative care. They are more likely to delay needed medical care and more likely to seek treatment for what would have otherwise been avoidable illnesses in costly emergency room settings. This results in higher uncompensated care costs for hospitals, which in turn increases medical bills and insurance premiums for families and small businesses. I really fail to see how this will help states or families recover from our severe economic downturn. Mr. Chairman, if our goal is to help states that are struggling at this time of economic downturn, let's focus on productive solutions that will create jobs and bolster the economy. I urge my colleagues to oppose this morally and fiscally flawed policy that will leave our vulnerable neighbors without access to health care and stunt our nation's economic recovery. Thank you, Mr. Chairman, and I yield back.